Drinking soda every day damages the artery. A new study involving 120,000 people shows that the sugar contained in sodas increases the risk of developing cardiovascular disease and therefore of dying prematurely. Sodas, industrial iced teas, syrups. Are sugary drinks a public health problem? This shows a study published on March 18 in the scientific journal Circulation, which concludes that they are the source of an additional risk of premature death. The study authors followed nearly 120,000 Americans for 30 years. The heaviest drinkers, more than 2 cans a day, have a 21% increased risk of dying earlier than people who don't drink sugary drinks at all. Such a link had already been highlighted by a study published in 2015. This new work provides additional important information. The greater the consumption of sugary drinks, the greater the risk of dying prematurely, plus 1% for less 1 soda per week, plus 6% for less than 1 soda per day, plus 14% for 1 or 2 sodas per day, and plus 21% for more than 2 sodas per day. The study shows that these deaths are mainly due to cardiovascular diseases, heart attack, stroke, etc., with a 31% increase in the risk of developing one for those who consume at least 2 cans a day, and each additional can is sanctioned with an increased risk of 10%. The researchers took into account a multitude of factors, such as smoking and diet, but according to them, this increased risk of mortality is attributable to sugary drinks alone. What happens when you drink a soda? The sugar contained in sodas acts on our body in various ways. First of all, too much glucose, a form of sugar, in the blood damages the inner walls of the arteries, making them more fragile and more susceptible to the accumulation of cholesterol. The latter penetrates there and promotes the formation of atheroma plaques which will gradually clog the arteries, causing, in the long term, infarction or cerebrovascular accident, CVA. When this excess of sugar in the blood becomes frequent, the whole metabolism is disrupted, leading to weight gain, hypertension or even type 2 diabetes. These are all factors that increase the risk of have cardiovascular disease. Sodas, worse than cakes? Why are sugary drinks more incriminated than other foods? Sodas, fruit juices containing added sugars or iced teas are the first source of pure sugar in our diet, explains Guillaume Walther, specialist in cardiovascular diseases at the University of Avignon. In these drinks, there is no dietary fiber, but it is they that slow down the rate of absorption of sugar in the blue. This is therefore absorbed immediately, which increases blood sugar in the blue blood more than a cake containing the same amount of sugar. Once in our blood, sugar begins its destructive WOR. This is what Guillaume Walther and his team discovered during a study published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology in 2017. Our arteries have an innate ability to adapt their diameter according to the needs blood from our organs, but a can of soda is enough to temporarily disrupt this capacity for dilation, explains the research. Even in young and healthy people, we observe this dysfunction. Clearly, an overdose of sugar, even punctual, puts our arteries in difficult. Normally, the cells that line our arteries produce nitric oxide, which is a vasodilator. It causes the blood vessels to widen, explains Cyril Rabault, researcher and co-author of the study, with William Walth. But the rapid rise in blood sugar caused by a sugary drink leads to a decrease in the production of nitric oxide and therefore a decrease in the ability of blood vessels to dilate, he specified. In addition, this hyperglycemia promotes oxidative stress, a chemical phenomenon that is harmful to cells. According to the researchers, this transient effect could become chronic if the consumption of sugary drinks is regular, significantly damaging the state of the arteries and increasing the risk of eventually developing cardiovascular disease. According to the latest nutritional recommendations from the National Food Safety Agency, ANSES, it is better not to drink more than 1 sugary drink per day, a quantity that is already excessive according to these studies. See also, light drinks would promote obesity.